This episode is brought to you by Indeed. Stop waiting around for the perfect candidate. Instead, use Indeed sponsored jobs to find the right people with the right skills fast. It's a simple way to make sure your listing is the first candidates see. According to Indeed data, sponsored jobs have 4 times more applicants than non-sponsored jobs. So go build your dream team today with Indeed. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Every sip of Coca-Cola brings you closer to the excitement of the FIFA World Cup 26. Because nothing compares to the joy. So grab a Coke and drink in the FIFA World Cup 26. No purchase necessary. 13 plus in 50 U.S. states and D.C. with a web-enabled device. Ends March 1st with 8 entry periods. Rules at cokeurl.com/soccer rules.
New Year, same extra value meals at McDonald's. So now get 2 snack wraps, plus fries, and a medium soft drink for just $8.
For limited time only. Prices and participation may vary. Prices may be higher in Hawaii, Alaska, and California, and for delivery.
Hello, everyone, and welcome to the Med Prep to Go Step 1 podcast. My name is Chris Breitigan, and I'll be your reader for today. In today's episode, I'll be reading 3 immunology questions from our Step 1 qbank, starting with Question 1, Immunology 4. An 18-month-old boy is brought to the physician's office by his parents for evaluation of recurrent nosebleeds. In the past year, he has had 4 respiratory infections and 3 episodes of otis media. Past medical history is otherwise unremarkable, and he does not take any medications. His immunizations are up to date, he is at the 4th percentile for both height and weight, his vital signs are within normal limits. Cardiopulmonary examination shows no abnormalities. There are dry, scaly, white lesions on his forehead, cheeks, and elbows. Hematologic studies show the following. Hemoglobin, 13.7 grams per deciliter. Hematocrit, 43%. Mean corpuscular volume, 89 cubic micrometers. Leukocyte count, 10,000 cubic millimeters. Platelet count, 90,000 cubic millimeters. Partial thromboplastin time, 35 seconds. Prothrombin time, 15 seconds. Which of the following laboratory findings would most likely be present in this patient? A. Decreased IFNY. B. Decreased IgA. C. Increased IgE. D. Increased IgG. Or E. Increased IgM. And the correct answer is C. Increased IgE. Male patients with thrombocytopenia, eczematous skin lesions, and recurrent infections are suspected to have Wiskott-Aldrich syndrome, WAS, an X-linked recessive immunodeficiency disorder. Patients with WAS have a defect in the WAS protein, which is important in the organization of cytoskeletons in lymphocytes and platelets. Thrombocytopenia will cause increased bleeding, and impaired T cell function will lead to abnormal immunoglobulin isotypes in recurrent infections. WAS patients are observed to have elevated IgA and IgE levels, resulting in eczema and decreased IgG and IgM. Answer choice A, decreased IFNY, is incorrect. Decreased IFNY points to IL-12 receptor deficiency, a congenital T-cell immunodeficiency that presents with severe mycobacterial and fungal infections. Answer choice B, decreased IgA, is incorrect. Patients with WAS present with increased IgA, not decreased IgA. Answer choice D, increased IgG, is incorrect. Patients with WAS have decreased IgG levels. Answer choice E, increased IgM, is incorrect. Hyper IgM syndrome is caused by a deficiency of CD40L in CD4 plus T cells, which leads to a defect in class switching from IgM to other immunoglobulins. Thus, hyper IgM syndrome will show increased serum IgM and will present with severe pyogenic, viral, and fungal infections early in life. Key learning point. Wiskott-Aldrich syndrome presents with the classic triad of recurrent infections, bleeding-caused thrombocytopenia, and eczema. It is also associated with increased IgE and IgA levels and decreased IgG and IgM levels. Next question, Immunology 5. A 6-year-old boy presents with his mother to the pediatrician for evaluation of progressive unsteadiness, which his mother first noticed when the patient was a toddler. She reports that his trunk has always been unstable and that he seems to wobble when he walks. Past medical history is significant for recurrent sinopulmonary infections. He does not take any medications, and vital signs are within normal limits. Physical examination is significant for an ataxic gait and telangiectasias on the bilateral conjunctiva. Results of a complete blood count indicate mild lymphopenia and no other abnormalities. A mutation in which of the following genes is most likely responsible for this patient's presentation? A. ATM gene mutation, B. BTK gene mutation, C. LYST gene mutation, D. STAT3 gene mutation, or E. WAS gene mutation. And the correct answer is A. ATM gene mutation. Ataxia telangiectasia is an autosomal recessive condition commonly caused by mutations in the ATM gene, which impairs double-stranded DNA repair and renders the individual extremely sensitive to radiation. Accumulation of mutations typically presents with ataxia, telangiectasias, low IgA, IgG, IgE, lymphopenia, and elevated alpha-fetoprotein, AFP. Answer choice B, BTK gene mutation, is incorrect. BTK mutation is the etiology of X-linked A-gamma globulinemia, in which B cells fail to mature, leading to low levels of all immunoglobulins. Patients with this disease typically present after 6 months of age with bacterial and enteroviral infections due to the loss of maternal IgG at this point. Answer choice C, LYST gene mutation, is incorrect. LYST mutation is a cause of Chidiac-Higashi syndrome, which disrupts lysosomal trafficking. Patients with this disease present with partial albinism, peripheral neuropathy, neurodegeneration, and pancytopenia. Answer choice D, STAT3 gene mutation, is incorrect. Mutation in STAT3 leads to hyper-IgE syndrome, an autosomal dominant condition in which Th17 cells are deficient and neutrophils cannot be recruited to infection sites. This leads to non-inflamed staphylococcal abscesses and typically presents with high levels of IgE. Coarse facies, retained primary teeth, and atopic dermatitis may also be present. Answer choice E, WAS gene mutation, is incorrect. A mutation in WAS is responsible for Wiskott-Aldrich syndrome, an X-linked recessive disease in which disorganization of the actin cytoskeleton leads to defective antigen presentation by leukocytes. Thrombocytopenia and elevated IgA levels are typically present. Key learning point. Ataxia telangiectasia is caused by defects in the ATM gene. It typically presents in the first decade of life with ataxia, telangiectasia, and frequent sinopulmonary infections. Question 3, Immunology 6. A 10-year-old boy is brought to the pediatrician by his mother due to a 3-day history of fever, fatigue, and joint pains. He had a sore throat approximately 3 weeks ago that resolved without medical attention. The mother reports that over the past day, he has complained of pain that started in his right knee and then shifted to his left ankle. She also noticed that he seemed unusually clumsy and has had difficulty writing compared with his usual neat handwriting. He has no significant past medical history and takes no medications. Immunizations are up to date. Family history is unremarkable. Vital signs are temperature 38.7 degrees Celsius, 101.7 degrees Fahrenheit, blood pressure of 106/68 millimeters of mercury, pulse 102 beats per minute, and respirations of 18 per minute. Cardiac examination reveals a new grade 2/6 holosystolic murmur at the apex. His joints are tender but not swollen. Skin examination shows erythematous, serpiginous, non-pruritic lesions on the trunk. Neurologic examination reveals mild coriform movements of the hands. Which of the following is the most likely diagnosis? A. Infective endocarditis, B. juvenile idiopathic arthritis, C. rheumatic fever, D. scarlet fever, or E. systemic lupus erythematosus? And the correct answer is C. rheumatic fever. Rheumatic fever is a post-streptococcal autoimmune complication that typically occurs 2 to 4 weeks after untreated or inadequately treated pharyngitis caused by group A Streptococcus, Streptococcus pyogenes. The diagnosis is made using evidence of prior strep infection and 2 major criteria, or 1 major and 2 minor Jones criteria. Major criteria: Jones mnemonic. Joints: arthritis, usually migratory polyarthritis involving the large joints, obvious carditis and valvulitis, pericarditis, myocarditis, or endocarditis, nodules, subcutaneous, erythema marginatum rash, sydenham chorea, neurological disorder causing rapid jerking movements. Minor criteria: fever, arthralgia, joint pain, elevated erythrocyte sedimentation rate or C-reactive protein, prolonged PR interval on electrocardiogram. This patient meets the major criteria as follows: migratory arthritis, joint pain that began in the right knee and shifted to the left ankle, carditis, a new holosystolic murmur likely indicating mitral regurgitation, sydenham chorea, neurological findings such as the clumsiness and difficulty with fine motor tasks, and erythema marginatum, presence of serpiginous non-pruritic rash on the trunk. He also meets minor criteria, including fever and arthralgia. The history of recent sore throat provides presumptive evidence of recent streptococcal pharyngitis, satisfying the requirement for evidence of prior infection. Thus, this child meets multiple major criteria and minor criteria in the context of a recent streptococcal infection, confirming a diagnosis of rheumatic fever. Answer choice A, infective carditis, is incorrect. Infective carditis involves continuous bacteremia, often with fever, a murmur, and possibly embolic or immune-related signs. However, it usually occurs in individuals with underlying valvular disease or intravenous drug use and is not preceded by pharyngitis. Chorea and erythema marginatum are not features of infective carditis. Answer choice B, juvenile idiopathic arthritis, is incorrect. Juvenile idiopathic arthritis presents with persistent arthritis lasting greater than or equal to 6 weeks in a child under age 16. It may include systemic symptoms in some subtypes, but it typically does not include carditis, chorea, or erythema marginatum, nor is it associated with a preceding streptococcal infection. Answer choice D, scarlet fever, is incorrect. Scarlet fever is an acute illness caused by streptococcal exotoxins, presenting with fever, pharyngitis, and a sandpaper-like rash. It occurs concurrently with streptococcal pharyngitis and does not cause migratory arthritis or chorea. It also lacks cardiac and neurologic findings. Answer choice E, systemic lupus erythematosus, is incorrect. Systemic lupus erythematosus, SLE, may present with fever, arthritis, rash, and sometimes carditis, but it is rare in young children and does not follow streptococcal infection. The presence of chorea, erythema marginatum, and a new murmur in the context of recent pharyngitis supports rheumatic fever rather than SLE. Key learning point: rheumatic fever is a type 2 hypersensitivity reaction that occurs after infection with Streptococcus pyogenes and is diagnosed using the Jones criteria. It classically presents with migratory polyarthritis, carditis, chorea, erythema marginatum, and subcutaneous nodules, especially in school-aged children. Those are all the questions I have for you today. Thank you so much for listening. If you enjoy the podcast, please be sure to leave us a rating and review wherever you are listening. And please follow us on our socials at MedPrep2Go on places like Instagram, Facebook, YouTube, and LinkedIn. You can also get all of these episodes ad-free along with Crush Step 1 in our USMLE Step 1 bundle. Details at medprep2go.com. Thank you for listening and happy studying.
Well, the holidays have come and gone once again, but if you've forgotten to get that special someone in your life a gift, well, Mint Mobile is extending their holiday offer of half off unlimited wireless. So here's the idea. You get it now, you call it an early present for next year. What do you have to lose? Give it a try at mintmobile.com/switch.
Limited time, 50% off regular price for new customers. Upfront payment required. $45 for 3 months, $90 for 6 months, or $180 for 12-month plan. Taxes and fees extra. Speeds may slow after 50 gigabytes per month when network is busy. See terms.